welcome to this session. I am Jalynn Tiffany. I am with 2020 Mom. I work in the DC area as what is our DC liaison, which basically means I do the things that need to happen in DC before we added our DC-based staff and work on the Mom Congress event for 2020. I want to remind you that this session is being recorded and things provided in the chat will be part of the transcript of this recording if you are messaging everyone. I have attended the forum for the last 4 years, the first two in person, which was fantastic to spend February in LA when you're from the DC area, but I'm very aware that moving the forum due to COVID to a virtual platform has increased our access or the availability of this information to 4 times as many participants. We've gone from around 200 to 800 to 1,000 participants each year. So when I'm down about something other than COVID related, I remember that this is one of the benefits. I'm pleased to introduce our speakers. Actually, they're going to introduce themselves. And they will guide what they said will be an interactive presentation. You can add questions to the chat if you would like. If we are not able to get to all questions, you can enter them in the Q&A section in the Whova app, and our speakers will be able to answer them over time for you. The session will also be available in the Whova app for the next 6 months. If you need to come back to it to reference information, or if you unfortunately have to leave us early. So welcome to Jana and Jackie.
Well, hi, everyone. Before we even introduce ourselves, for those of you who've been participating all day so far, I feel like it's been a lot of emotions and a lot to hold and be present with. And so before we get into that piece, I'd love to guide everyone just in a grounding exercise. So I can't see anyone, but I'm hoping that everyone will be able to get a little bit of benefit from this. And so I want you just to notice right now how you are physically seated and try to get a little bit more comfortable. Just kind of settle into your space and just recognizing where you might be holding a little tension or discomfort. And then hopefully a lot of us are bare feet because we don't have to be out and about. But I want you right now just to place your feet on the floor, if that is possible. And just notice the feeling of your feet, whether that's inside your shoes or socks, and just how that contact feels on the floor. And gently press your feet into the floor. Feel your leg muscles working. And now just relax and sit back in your chair or sofa. And notice your body where you're sitting and the feeling of gravity. And return your attention back to your feet on the floor. Just notice the position of your arms and your legs right now. And bring awareness to your breathing. Be aware of the air that's going in and out of your nose or your mouth right now. And just notice your body. And now take a moment to zoom out and listen to any sounds that are going on right now around you. Whether that's a lot of noise or peaceful silence. And try to identify 1 or 2 sounds that you're aware of. It might be an electrical device, It might just be your own breathing. And now come back to your body in the chair and notice the feeling of your body having gravity. And just become aware of the temperature of the air around you. Noticing right now what you smell. If there are any tastes that are still lingering for the last thing you might have tasted. And just give yourself the space to relax. And if your eyes were shut, if you'll go ahead and open your eyes and look forward and notice your surroundings. And to yourself, just gently name 3 objects that you see and describe them in your mind right now. Now let them go and come back to your body in the chair. And notice that feeling of gravity. You are here right now. Now we're going to turn our attention and our focus back to the task at hand. And if you need to, you can gently move your body around to kind of awaken it, bring it back to the room. And now I'd love for everyone to really take a moment to think about what brought you here today, specifically to this session. So whether you're here live with us, whether you're going to watch it on the replay, you had like 11 sessions to choose from. What made you come to this one? It might be a person. It might be an event. It might be a story you've heard. But right now, I want you to bring that person, story, or an event to mind and hold it close. Because this is your motivation for today and for you showing up and for the information that we are going to share and hopefully infuse into your work in the future. But if you have a difficult moment throughout the day or anytime during the rest of this wonderful conference, I just want you to bring that motivation to mind because it can recenter and ground you and help remind you of your why. So with all that being said, Jackie, do you want to introduce yourself?
I'm ready for a nap. Thank you so much for that, Jana. I think it's critically important for us to be able to notice our own bodies and be present and be grounded as we hold space for those that we support in the community. So yeah, super, super excited. And also, as you talked about, that why, remembering your why. And, I always have this little Post-it that's here on my screen that literally just says, connect to your why. So I love that you said that. And just as a reminder for those that are here with us or listening to this later, connecting to your why really gives you purpose and grounding, even when it gets a little difficult. So really inviting people to remember that. Yeah, so I'm excited.
You want to tell everyone a little bit about yourself and how you ended up here today?
So how much time we got? No. So my name is Jackie. I am situated in Philadelphia, the stolen lands of the Lenape people. And I am a somatic social justice art therapist. It's kind of like my lead title, but anything somatic, also perinatal mental health certified. So I really work specifically with the Black community around trauma and how that how it impacts that intersectionality of folks. So and very specifically looking at how that impacts that whole perinatal period that we're talking about today. Do tons of different somatic based practices, including brain spotting, which is what we're really focusing on today. And founder of Sankofa Healing Studio here in Philadelphia, that really supports our community.
She's being much too kind. She's absolutely amazing. And I feel lucky to be able to work with her. And so glad that we're able to do this here together.
Yes.
And so I'm Jana Glass, and I am located in Atlanta, Georgia. And I'm a licensed counselor, and I also have the perinatal mental health certification. I also really focus, the niche of my practice is general trauma, addictions, and perinatal mental health and trauma. And so for me, the way that I love helping people find healing is through brain spotting. So we're so excited to share that with you today. But a little bit about how I came to this is in my private practice, it's very close to reproductive assistance centers in Atlanta, like 5 different ones. And the hospital that I overlook, literally more people give birth in the United States at this hospital than anywhere else in the United States. And it's called Northside Hospital. And so as I was building my practice, I started getting people who had perinatal concerns, organically referred. So I started really deepening my work with that and getting lots and lots of training. And then in a twist of fate, I ended up needing all of the same things that my clients needed because my personal journey to parenthood was very difficult. And if you think about the different stages and phases that we're going to talk about where perinatal trauma could happen, I experienced all of those. And so for me, I was already deep in the perinatal work and deep into brain spotting, but it's where I got my personal healing from all the trauma I experienced. So even though I was already really rooted in it, for me, this was now a way to give back and be a gift because it was such a gift to me. So all of that being said, I don't know if you want to add anything, Jackie, or if we should go into
I guess just a really small, I realized I'm like, I guess I'd be remiss not to say that I am an LPC. So I am a licensed therapist and practice in a couple of different states. And I guess if I really want to look at the niche, for me, it's really around structural racism and how systems impact communities as a whole in collective ways and also in the individual ways. So for me, really looking at incarceration and what that looks like on, from some of the juvenile, the ways that we interact and treat our children, straight through to adulthood and what that all looks like in the mental health impact. And oftentimes it's our birthing persons. So one of the fastest growing groups is Black women and femmes who are incarcerated at these alarmingly high rates. And they are within, kind of those birthing years as well, and also having young children. So it's, when I think of my why, that is, I think, very connected to why I do perinatal and made sure I got plenty of training in that because I see so much of it, whether people are coming in for that or not. It tends to be very, very present for them. So yeah, so this is definitely a passionate conversation for me.
Absolutely. Now I guess on to the slide deck you guys have. We're really kind of using this more. Oh, did I freeze?
Nope, you're here.
Oh, okay. Well, all of a sudden, oh, there it is. Okay. I was like, my slide show's gone. And so we're going to be talking about using brain spotting to heal perinatal trauma. And if you need to find us at any time, you will be able, oops, let me go back. You will be able to find us through these different websites. And so when we talk about trauma, I think it really helps, there's not one sole definition around it. So this is where if people want to drop messages in the chat or unmute and share, like we put some information on different definitions of trauma, but I'm curious to hear some of the participants, what they would say. If my client says, well, what's trauma anyway? What are we talking about? I think you guys can look in the chat. So you can read through and see some of the different pieces. And so sometimes our personal definitions that come up, like Emily, thank you for piping up. So that's so key. Anything the person views as traumatic. I think that is such a huge point because trauma really is in the eye of the beholder. And some people that you are going to work with are going to have seemingly overall good experiences according to the chart, according to their partner, according to the people around them. But there may be something that individual found unsettling or overwhelming. And so the only point of view that we're going to care about is the person's point of view we're working with. So I think that's a really, really huge piece. I really like the somatic experiencing definition as well. And people feel free to keep dropping ideas. Anything that's too much, too soon, or too fast that overwhelms our nervous system. I think that's a great definition as well.
Yeah, a couple of the others being dropped in is exactly when it's just not, it doesn't go as expected. And it elicits that emotional response. It causes these adverse outcomes to our systems. Absolutely. Thank you for sharing those things.
Completely. But I think part of the challenge we have is our clients are still making sense of what happened to them. And they're not sure what trauma is. And I think so often people associate trauma with specific events, like being in active combat or being in not just a car accident, a rollover car accident. And so, for sure, I think we can agree some of those things would absolutely be traumatic for most people, but sometimes it's much more common what can be traumatic. And so it's just making sure that as we're taking all of these potential definitions, that we're really keeping that person and their experience in focus. Ooh. Sorry. So here's what we're doing today. So we're about to define the perinatal trauma. We're going to look at what contributes to perinatal trauma with the intention of how to reduce it. You're going to learn some general information about brain spotting. I wish that we had more time, but with the hour and 15 minutes, we'll do a really great overview and how it can be helpful, especially in the perinatal population with trauma, and how it can be used as a liberation or neuro-experiential approach, which I think is so important, especially with all the topics today, and really how we can use it to support communities of color that are impacted by structural racism. You want to go, Jackie?
Yeah. So I guess just to even set the tone, so what is the perinatal period? So as we have in there, it's that time period during pregnancy and up to 1 year after delivery. And when we're looking at the trauma that impacts that entire timeline. So I think it's really contextually, it's important because sometimes people may think of just during pregnancy and not necessarily consider that full year after delivery as well.
Well, and what we see, especially through a trauma lens, is that if someone experienced trauma and was not able to get the support that they needed for the trauma to be released, it stays with them. So I will have some clients who are way past reproductive age, but as we start engaging in, the trauma process, some things from their births have been brought up, even though some of their children are adults. And so I just push everyone to really expand that timeline in their mind, that yes, when we're talking specifically from a hospitalized model, it's birth through the first year. And I actually just saw a recent research study that I need to dig into more that made the case that it actually went birth to 3 years, which I still think can be a bit inadequate. It depends on what we're talking about. But when we're in the trauma realm, I think even though some people might have a 5-year-old, if they have not been able to address their trauma in a way that gives them relief, they're going to stay traumatized. So even though you won't find a textbook or a physician who would say the perinatal period is extended, I just urge you guys to consider that in your context with the people you're interacting with.
Absolutely. I think that's a really a great, point. Because I think even you and I have spoke. I think my son was in his 20s before I realized like, that was trauma, because thinking of, folks around me, it was like, oh, well, this just happens. So really being able to center our clients' experiences during that longer period of time as well of how they are able to cope with it going forward.
Completely. And so when we think about perinatal trauma in particular, so like here's the irony: if you Googled perinatal trauma, the definition that would come up first, and I'm actively trying to change this, is that any injury sustained during the birthing process to the baby. And I think that's pretty relevant, that, and look, in certain circles and certain lenses, that would make a lot of sense. But I think expanding that definition to include both the birth giver, the supporting partner, if there is one, the staff who are present during a difficult circumstance, whether that's during pregnancy or trying to conceive or postpartum, but really recognizing that for some people it's one event and other people it's a series of events through their journey to become a parent. And these 3Ds, I think, are pretty important. So it's either distressing, dangerous, or disturbing, and maybe it's all three, that really causes ongoing challenges with both emotional regulation and physical regulation. And that this is the eye of the beholder again. They're perceived negatively in the present, even though it was experienced, potentially during the perinatal period or earlier. So again, it makes that case for expanding beyond that 1 year, even if it's just in our perception. Oops. And so as you look at this image, I'm curious what things stand out for you, whether you're thinking about yourself or you're thinking about your clients or who you serve. There's a lot of words there, but they're all incredibly important and part of the fabric of perinatal trauma. So feel free to unmute, feel free to drop it in the chat. I know it's a lot to look at. I think one that stands out for me, personally and in my work, is the idea of ancestral trauma. I think that's really huge. I have been working actively with a client who, was told she really wouldn't get pregnant, but she did. And she had a very uneventful pregnancy as she was going through it. And right up at the end, she felt like something was wrong. And everyone told her she was being silly and that babies stop moving towards the end. And unfortunately, she had a stillbirth. And I met her after this, but one of the things that she experienced was, in the moment, she did not want to see her baby or hold her baby or interact with her baby at all. And so I met her after that, and we were kind of working through that overwhelm and the decisions made at the time. And probably after about 8 sessions, she just casually mentioned that her mother had also been pregnant and was in a car accident before she was born and had a stillbirth as a result, and that the mother did not hold the baby or see the baby or interact with the baby. And in that moment, I recognized, wow, this is way more than just one moment. This is really something connected through at least one generation. And that's really, really powerful to look at. So that stands out for me.
Yeah, I'm seeing people dropping the chats that some of the stuff that I personally really that stands out for me, including like that denied experiences, opportunities missed, disconnection, being left behind, broken bonds, detachment, loss of purpose, you know, and all of those things. So it really, I think, allows us when we're looking at this slide to expand what we're thinking about when we're thinking about trauma and how impactful that can be. Yeah, loss of self.
And so in the backdrop of all current events of all kinds, that's woven into the fabric too, that even though those may not be direct impact, they're still part of the overall mental load and stress, in addition to what you are firsthand experiencing.
Yeah. And also shapes
Yeah.
the experiences, right? It also shapes those experiences of how we then internalize whatever those experiences are. Definitely shapes the way that we then respond to them. Yeah, and self-criticism, you know, being internalized blame and shame, and how impactful that is long term as well.
I really appreciate you people putting things. We can't see all the tiniest ones, but I appreciate of the bigger ones, people putting things that they think should be in there. And it's definitely something to look at updating. Numbing, yes, absolutely. I think that is a very, very typical response. And so whether that is literally just losing your feelings or deciding, just because I also have an addiction lens I look through, actively numbing yourself with substances or activities so you don't have to be present with those really big feelings. So I think thank you, Annabelle, for saying that. So I think it hits a whole range of things. And these are all things for us to be looking at as we are sitting with the person in front of us, whatever context we're serving them in.
And fear. Yes, thank you for adding that in there, Jessica. Absolutely, fear.
I'm writing down all the ones that aren't big out there.
Yeah.
And you
I
guys
think,
should have
this
it.
is just an amazing tool that could just also open the doors for discussion.
Mm-hmm. And loss of connection, that's huge. And so the way that I see, because kind of dovetailing off the substances conversation, I really see the opposite of addiction being attachment as opposed to sobriety. And so the connection is such a big piece of that. So whether we're talking about substances, whether we're talking about not being present in our bodies, that connection and the losing the connection and trying to regain that is such a huge part of the recovering process. So let's talk about how many people could this possibly affect, right? On firsthand, when you hear when I say only 8% of women, or really birth givers, experiencing trauma symptoms after giving birth, you're like, oh, 8%. I mean, that leaves 92% of us who aren't carrying that, right? But if you look at 130 million babies being born each year across the globe, we're talking about over 10 million people. And the reason I think I used women, I try to be gender neutral, is this statistic was only focused on women or people who identify as women as birth givers, because I try very hard to be inclusive, but I think the CDC has yet to catch up with that. And the stat that's most recent is from 2017. 3.8 million babies were born in the US. So we're talking about over 300,000 people who experience perinatal trauma. That's not just perinatal mood and anxiety disorders, that's trauma. So we have a lot of work to do. And so when we look at perinatal trauma, I feel like it's really helpful to look at the different stages and phases of becoming a parent that the trauma could exist within. So this is hopefully a really general overview, but can help expand your lens so that when you're talking and interacting with someone who's seeking whatever service you provide, that you are able to really ask about these different experiences. Because even when I ask later on, a lot of my clients, it takes them time to either get comfortable enough to share. It's not just in the intake session, or it's only through our work and moving towards healing that they feel ready to share some of their experiences. So I don't look at it like them intentionally withholding. I look at it like it's their pace and their speed. But this is just an overview to give you guys an idea of the areas to look at and things to be inquiring and things to be looking for. And so pre-pregnancy, first of all, taking into consideration that people walk into this role with trauma that has nothing to do with becoming a parent. So whether that was in their own births when they were being born, whether that was early childhood, adolescence, young adulthood, etc., all of those things are brought into parenthood if they exist in a trauma form. And then a pregnancy or attempting a pregnancy is just going to amplify all of those. So just being aware of what they're bringing in, challenges they may have faced around fertility. Not everybody who has sex at the right time on the right day is going to be able to conceive well. And, this statistic is 1 in 8 people who actively are trying to have a baby are going to need some kind of support to do so. So if they do go down that route, we're looking at invasive procedures at a minimum, all the way through surgeries. If they go all the way into IVF, we're talking about injections, and all without a guaranteed outcome. And so for these folks who enter that arena, so many of them have had the belief that if you just work hard and follow the rules, that you'll get your outcome. And it's a really hard lesson for some of these people to do everything asked of them and to try so hard to reach a goal and not be able to reach it. And then we talked about in the beginning, any experience prior to that, the partner as well, that anything that might have been endured prior to that are bringing to the role of potential parent. You want to talk about pregnancy, Jackie?
Yeah, and then so that's just getting through the pre-pregnancy piece. Then when we're looking at pregnancy itself, there's so many different things that can happen. So when we're looking at death, and that could be a result of so many things, including miscarriage, stillbirth, SIDS, a NICU death, abortion, selective reduction, all of these things and complications during pregnancy. So the placenta challenges, the abruption, the previa, the accreta, preterm labor and birth, twin-to-twin transfusion syndrome, preeclampsia, the HELP syndrome. So as you see, there's an extensive list, and these are just some of the things that are noted here, but just some examples of perinatal trauma.
And so when we look at, complications during actual birth. When there is a premature birth, 67% of, and again, this was mothers because that's how the literature was done, report having post-traumatic stress disorder symptoms just by having their baby early, even if the birth itself was okay for the individual. And of course, some people do have very traumatic labors or deliveries. Sometimes unwanted interventions are utilized, not always with the individual's consent. And sometimes emergency C-sections are necessary. And in those cases, the birth giver isn't physically present during the birth of their child and wake up later to potentially meet them, assuming that the birth went well. And in other times, things that get missed are whether we're talking about different tears that can occur during the birth process, or an episiotomy may take place. But these are all kinds of things to consider and to check in around about, when you're asking someone to talk about their birth story. And so during the actual neonatal period, so the baby has made it earthside, sometimes even when necessary, even when medically indicated, having a separation from the baby can be extremely traumatic for both the birth giver and the partner. It can be a very uncertain time. And the first thing that you want to do is hold your baby. But even if you reference the movie from today, the way that went, the baby was whisked away, even though that might have been medically necessary, but that was absolutely a rupture for both parents in that moment. A NICU stay needing to take place can also be very, very traumatizing. Unless you predetermine know that there is a specific complication that would need NICU support, neonatal intensive care support, most people are very surprised and don't wish to be a part of the NICU community. I don't think anyone wants that, but most people had no idea it was coming until it was there. So that in and of itself can be very traumatic. Sometimes it's just for the baby needing to feed and grow, and other times it's for medical complications or treatment that's needed in that NICU setting. And then the birth giver themselves can have complications that come from the birth process. Some of those are listed there. And then, of course, a lot of us are acutely aware that even if you had very little trauma coming in, even if you got pregnant exactly when you wanted to, had a model pregnancy, and gosh, even your birth went pretty well, that there is still the possibility of developing perinatal mood and anxiety disorders. And of course, on the more extreme spectrum, a postpartum psychosis could occur as well. And so I don't know, Jackie, were you watching the chat? I saw some stuff come up, but I don't know. Okay.
Yes, I think we skipped. Did we just skip a slide?
Did I might have.
Yeah. Yep. There.
Wait, I'm going the wrong way.
Wrong direction.
Sorry.
There we go.
Okay.
Yeah, and I think this is such an important slide because these are less recognized, but it doesn't mean that it's less impactful. And in some of what we're seeing in the chat is speaking about that. So one of the things that's in the chat is talking about moms who witnessed, are present for school shootings and seeing blood for the first time and really understanding how impactful that is. But that's not something that's necessarily on our radars unless we are opening up, what we consider being perinatal trauma, to even ask those questions and looking at structural racism. So poverty, inequity in healthcare treatment and access, and implicit bias. And that's some of the things that would be also covered in that film as well. Very, prevalent in so many lives, specifically with communities of color, the environmental stressors, incarceration, housing, food insecurity, lack of community or family support, challenges accessing childcare. And it's also super important for us to remember, again, this does not mean that this is a blame or a shame for the birth giver, but really looking at the environmental pieces that impact them. The physical separation that you just talked about, feeling inadequate as a parent when the child is in NICU, because you have the experts that are there and, relying on their professional judgment or guidance, but at the same time, maybe it's not in alignment with what it is that you want. And you may feel silenced. Difficult pregnancy or delivery that has a good outcome. So sometimes you have these difficult, that pregnancy or delivery, and you may have very well-intentioned people who kind of want you to forget about that because there's this good outcome. So, well, it could have been worse, and just look on the bright side. And again, that's minimizing somebody's voice. And loss early in pregnancy or a quick NICU stay, because again, sometimes it winds up being minimized of how deeply that impact is. In addition to when you're involved in any of the systems, of someone telling you how you should care for your baby and what that looks like as a birth giver, not having full autonomy.
I know for me, I gave birth to twins, and they were a bit early and they needed to go to the NICU. And my well-intended support system said things to me like, well, isn't it great that you get to go home and settle in and you get a good night's sleep while the babies are still in the hospital? And it compounded my grief because I felt like, no, that's not what I want. I don't want to be home without my children. I've waited forever to hold them. I don't want to be separated from them. I'm not getting a good night's sleep. When I'm in the house, all I feel is the absence of them. I don't feel like, wow, this is a vacation before I get to parent. And so I think that's part of just one example of how some people get someone's experience wrong and how important it is, instead of making blanket statements, to ask someone like, so how is it to go home without them? How is that for you? And that would have been way more helpful.
Yeah, and I think that there's, a couple of other things added to the chat.
Mhm.
Jerry mentioned the idea of grief, really looking at the grief of the lost expectations or loss of the experience that was planned for. And I think this is really key in what we're talking about. Healthy mom and healthy baby doesn't always equal good outcome. And society doesn't necessarily get that. And to really be able to hold space for that.
Completely. So this is information to really look at things that are very small adjustments that can really help reduce or mitigate trauma. So this focuses on a study from 2017. And a huge factor of perinatal trauma, we've talked about this though, is the birth giver's perception of care by doctors, nurses, anyone else around on their care team. So how the birth giver experiences it. So, over 2,100 people, women, who had self-reported traumatic childbirth experiences. So they identified themselves as, yes, I had a traumatic birth. They were asked about different aspects of the trauma and how it could have been prevented by the caregivers or by themselves. And the participants really looked at this and said, it really came down to things like feeling like they had no control or that they lost any control that they had, that there was specific issues around communication with the care team, whether that was the care team wasn't clear or did not give full informed consent about what was going on, as defined by both the benefits and risks of a procedure before it happens, whether they didn't feel heard when they were expressing it, and then just not feeling like they had the practical or emotional support from their care team. And again, this is the birth giver. And so they really thought and expressed that their trauma could have been reduced or prevented by better communication, better support from those giving the care. Or a lot of them did blame themselves, which I hate this part, but they felt like if they had been able to ask for or refuse interventions, because often things are happening at a rapid pace. And so they don't always have the ability to advocate. But the other thing to remember about trauma, it's system overwhelming. So if you are in active labor, or even if you're not, and you're being told that something isn't going well with your baby, that's not the time that you're necessarily calm and grounded and in a place to advocate, right? So I think it's easy to look back and say, gosh, I would have said no, no forceps, or I wish I would have said no, let's not push Pitocin, or whatever it might have been. But I think that goes back to, we don't have enough time to talk in detail, but about what a birth plan really is, and being able to know what options exist, and making sure that the partner or the support person who might be there understands the point of view of the birth giver. And if that person cannot advocate for themselves, that they open their mouth and speak up. And even if that's not their general nature, this is their first role as that support person, that partner, that potential parent, whoever it might be, potential grandparent, etc., to be able to do that for the person who may not be in a place to be able to speak.
Yeah, and I think that's also a good place to highlight as well when we're talking about oppression within our systems. You know, people aren't given space to speak, or may not be listened to. So I think that's extremely important for us to also censor as we're talking with our clients. That, you know, there's this idea that if you are, you know, trying to voice some things that are going on, that you're complaining, or you're too loud, or too all of those things. And looking at specifically, you know, oppressed communities. And for me, when I look at with the Black community, that is one of those tropes, along with the strong Black woman. So that you're supposed to grin and bear it, you know, just bear all of those things, and how that has a long-term impact in your relationship to your own body and your experiences to even understand that it was perinatal trauma. So just for us to be really educated about that, that communication sometimes isn't enough because we need to make some system changes.
Definitely. And I love so many of the comments in the chat are so on point. You know, and I do just want to say that I think it's also really important that we try to join with the medicalized staff in solutions instead of making it more like a us them. I'm not saying people are doing that, but I just think it's really key to do that, because, you know, they are up against a lot of system challenges as well, and requirements that they have as well. And so I think to really change this, it's going to be an all-out collaboration ongoing, because especially with things like COVID, policy trumped most everything, including patient care. Like that the policy dictated, we have to do this, or you have to be having that. And so that might have been medically necessary and might have made sense, you know, when the pandemic was at higher rates, but that there's still fallout for the individuals in that process. And I love that Annabelle talks about how to go over and create a birth plan. I think that's so, so key. And the more people who have access to that, I think we're talking about ways to mitigate the trauma. And we'll talk about how to help heal it. But in an ideal world, if it never occurs, then we become less necessary as perinatal trauma experts. We become less necessary. We're the people who try to work ourselves out of a job.
Absolutely.
You want me to go? You want to go?
Yeah, so I can go. So the typical responses to trauma, you know, and we see this a lot. exhaustion, confusion, sadness, anxiety, agitation, numbness, which we also saw in the chat earlier, right? Dissociation, confusion. Well, yeah, so much confusion, we have it twice. Physical arousal and blunted affect. It is so important for us to know this whole range. But here's the thing, though. Those things also sound like childbirth in and of itself, that some of those things are there. So really understanding that these are things that are also responses to trauma, and it could kind of get a little blurred in there. Indications of more severe responses. So that continuous distress without periods of relative calm or rest. And I think that is so key. Severe dissociation symptoms, intensive intrusive recollections that continue despite a return to safety. And also keep it in mind there, what does safety look like? And is safety something that is accessible for all of the folks that we are supporting and working with? Delayed responses to the trauma can also include, again, persistent fatigue, sleep disorders, nightmares, fear of recurrence, flashbacks, depression, avoidance, and sensations or activities that are associated with the trauma. And when we're looking at that, those responses can lead to what we would consider this maladaptive coping, and also recognizing that that's kind of a loaded thing, as well as we talk about, what's maladaptive, but also recognizing as well, when we're trying to really have liberated spaces of care, how sometimes this idea of maladaptive coping is then mistaken and used and spoken about as being a cultural response, where it's not a cultural response in and of itself. It's this intense delayed, responses to trauma that individual groups are dealing with.
So some of the clients I work with, it shows up like, if their baby got a fever, like after after birth, etc., everything's going okay at home and their baby gets a fever, that they may have a really intense response of, oh my God, we might have to go back to the hospital. Oh my God, when we do, they're going to take her from me. Oh my God, where that's an indicator that someone may really have that trauma response. When we talk about the fear of recurrence, it's not that we're afraid that they're going to give birth again. That's that they may in the future, but it's really looking at anything that touches on that difficult event again and really gets amplified for that person. And so obviously we keep focusing on the individual for good reason. So we don't always know, but some of the common things you may see, not in everyone, but that are kind of reported, is blaming themselves, going over every action related to the situation, whatever the situation might be, trying to find where it went wrong and where they could have done something different. And I think that that's part of human nature, because if it's our fault, we can change it or we can protect ourselves, when in reality, that may not match what the situation called for, but really holding ourselves very accountable for the series of events, feeling like their body failed, either failed them or failed their baby, or if there's multiples babies. This is what I was put on earth to do, and this and that happened, and I couldn't even do that. So I think that can come forward. I think it can tap in and either strengthen someone's connection spiritually or religiously, or it could go the opposite direction where people are wondering, like, maybe I'm just not supposed to have a baby. And maybe this is God or the universe's way of letting me know that. And then through the process themselves, feeling a loss of control. I don't know how the story is going to end, and I don't feel like there's a lot I can do about it, because everything I've tried has failed so far, or hasn't gotten me where I wanted to be so far. We talked about the communications with their medical team, and, I've had people show up in my office at like 8.5 months pregnant, and they're like, I don't really like my OB. And you know what my response is? Look for another one. Because the last thing that you want to do is enter into the birth arena with someone you already don't care for or don't trust. And so even though I know it feels overwhelming to look for a new provider at that time, and I know that different people have systemic challenges with that, and not everyone has the ability to change that up. But if it's at all possible, I encourage them to explore it, because even if they stay with the same provider, they at least took action to do something a little bit different and explore their options, which I think can help. And then again, reiterating that lack of emotional support received by the team during the birth process. And so no one's expecting the whole team to go get a counseling degree, but kind words, encouragements, what some people may consider basic human kindness can go extremely, extremely far. And so when we're talking about trauma, it really overwhelms the brain's ability to process the event. And so on a brain level, it leaves pieces of the unprocessed experience frozen in time for that person, in time and space. So they don't have a fully integrated experience. Some schools of thought refer to them as trauma capsules. It's not that they're literally capsules in your brain, but it's unprocessed material. So what happens as you're interacting in present day, if anything gets into that neighborhood of that trauma capsule, you're going to find that your reaction does not match the circumstance. So if you had a flat tire, which is extremely inconvenient and difficult, but you found yourself screaming your head off and feeling like, I can't do this, I can't do this, I can't deal with this, then that might be an indicator that the response is out of proportion for what would be expected and is a possible indicator of trauma.
Yeah. Mitigating trauma with me, not to me. And how impactful that is just to see those words with me. I invite everyone, as you're looking at this slide, this idea of with me and what that means to you, and just notice your body, not trying to change anything at all, but that idea of with, how that sounds versus the to me, right? That I actually have some control. So I would say just maybe take a moment and notice your body. Maybe even say the words with out loud. And I would invite folks to maybe look around, find a spot on your wall, kind of look around, look forward, maybe a little to the right or a little to the left, and say with me. And just notice anything in your body. And see if there's any particular place that you look that maybe you have a sensation that's a little stronger than others. Maybe it's a different tingle, or there's some warmth, or you feel something shifting maybe in your belly. Whatever that is, I'm going to invite you to just notice it. And notice that as you look around, maybe other thoughts come up. Yeah. And just notice. And we'll talk a little bit more why.
For sure. That was beautiful. So reiterating again, it doesn't matter what is said in the medical record. We do not want to solely go by what's in the medical record. We want to look at the entire person, the person who is in front of us, their experience, their definition of what took place, their truth is the truth. Which brings us to, what is brain spotting? It's my favorite therapy. But aside from that, it really is amazing because it harnesses the brain's natural ability to heal and allows people to release emotional pain and positively shift unhealthy patterns and beliefs in that deep subcortical part of your brain. It's based on the belief that where you look affects how you feel. And you got a little teaser from Jackie. And what that means is there's literally a fixed point in space that if you're focusing on a particular challenge, event, or emotion, there is a spot in the world that you could look at that will enhance that process. And so in brain spotting, we're actually taking that power and using it to help people heal.
It's a resourcing approach. What does that mean? It promotes healing through relationships and trust that's built between a therapist and the client. That's really the core piece of it. That is the foundational part of this process. It's really, again, that with me, not to me. And for us, to be able to facilitate and support the repair work, so when we're talking about that communication and a client, maybe they didn't feel like they were in control or have any choices, and feeling, maybe they didn't feel emotionally supported in that healing process. Within this type of approach, it promotes that repair work so that clients are able to feel that they matter, their voice matters and is being centered. And super, super important is the clinician is fully present, and we're trusting the client themselves. We're not the expert in the room. They are. They know those experiences that they've had in the process. And, really being able to support our clients stay within their circle of capacity. And that's super crucial. It's not about what our capacity is, which is why we have to be so fully present, because it's not based on our capacity. It's based on what is the client's, what does their circle of capacity look like?
We want people to be able to safely revisit whatever they need to, whether that's a specific event, whether that is an emotion. But we want to make sure that as they're doing that, they could have a strong emotional reaction, but we don't want that to be system overwhelming. And that is what the practitioner is there to do, is make sure that the person is experiencing what they need to, but that it does not re-traumatize in the process. And so I think a key thing is it really helps repair the ruptures that have taken place, whether that's trusting yourself with your care provider, and it allows the story to fully integrate on a brain level. Because what trauma does is it messes with our timelines. And so even if it happened last month, last week, 10 years ago, trauma stays with us. It feels like it's always right here. It doesn't feel like that happened once upon a time. It feels like it just happened. And so as we're going through and doing the brain spotting and helping to process that event through to completion on a brain level, we allow it to take its rightful place in that timeline. So people will report to me that they feel like, oh my gosh, that now feels like a year ago, because it was. And then as time moves forward, you feel like you're moving further away from the event, not that it's followed you. And so it's really up to the clinician to be really present and to be able to evaluate the person's capacity for any specific emotion, whether they already have some good internal regulating skills, but it helps the clinician decide the approach to use with brain spotting. And our job during brain spotting as the clinicians is to be calm and present and grounded so that the person who is doing the work with us can co-regulate with us. And so it's really incumbent that anyone who engages in brain spotting is doing and has done a lot of their own personal work so that they can show up fully present to be able to do that. And then allowing people to honor their experience, honor their bodies and what they were able to accomplish. I just did brain spotting this week with someone who amazingly, their water broke at 19 weeks. And she was able to sustain that baby inside of her body till 31 weeks. And so during the processing, she had started out from a place of, my body failed me. My body failed my baby. My baby was uncomfortable and couldn't move around. She was breech and we couldn't adjust her because she had no amniotic fluid. It was terrible. To, oh my God, nobody goes to 31 weeks. I went to 31 weeks. Holy mackerel, right? And being able to really find that shift. And so many clients who have had spiritual disconnection or challenges with their spirituality or religiousness are able to connect more to themes, whether that ends up being Mother Earth for them or Mother Nature, Mother of all, anything that might be relevant. In some clients, it won't be, but being able to bring that into, because it's such a spiritual experience for the people who are engaging in brain spotting.
Yeah.
A question, Jana.
Mhm.
If you have multiple traumas, do you start with the first one or the most current and work backwards?
Yeah, that's a great question. So that's what's amazing about brain spotting is we don't make that call, the client does. And so we help them decide what's feeling most present or what's feeling most important now. And so we don't, even though I referenced a timeline, we don't have to start in any particular place in the timeline. It could be what is causing the most challenge now. And then it could go all the way back to childhood. It could go back to the reproductive process. But we as the clinicians are not prioritizing any particular order. It really is client driven and they get to make that call. We can support them in kind of the decision making through it, but there's not a rule where you start with the first or the worst or etc. Like I'm also trained in EMDR and that's more in that school of thought. And so is Jackie. She does a lot with EMDR as well. But that's more that school of thought. Brain spotting is much more what's feeling more present for you today, or which would you rather work on? Because for some people, it may be the most present, but it also may feel the most overwhelming still. So they may want to start with something that feels less overwhelming, but is still upsetting as a starting point, because sometimes any healing can have potentially a carryover effect. So if it feels like you have one kind of big monster that you aren't ready to take on yet, and the dragon you're not ready to slay, maybe the baby dragon is a better start. And I'm just using a metaphor, of course, or taking a piece out of that feels like it's easier to address at first. Like I said, the best way to really understand brain spotting is to go get a brain spotting session yourself. But outside of that, we're doing our best. These are normally 3-day long trainings all day. So we're doing our best to kind of give a great overview.
Yeah, I think really being connected to being in the present, which oftentimes we don't have space to just be and to start noticing, because our bodies, as we're talking about, right? Trauma lives within our bodies. And when we're talking about perinatal trauma and this whole birthing experience, it's very directly connected to our bodies, and really being able to hold space in a very different way, to be somatic based. As well as, like we're talking about here, we're talking about going, most current or going backwards. We can also go forward. So when we're talking about systemic racism, what are my concerns or fears for the future? What does my child's future look like when we're still dealing with systemic racism? How is this going to impact my ability to care for my child or protect my child? So all of those things come up. And I also see there's a question in here about experiencing daily trauma, from having an infant in hospice, as well as birth trauma and loss. And absolutely, there are no boxes. So whatever someone is experiencing, they have space for that, to really be able to sit with it. And sometimes there aren't words. Sometimes there's just body responses and reactions, which is a really great way to support our folks who have experienced trauma.
Excuse me, Jackie and Jana, we have about 5 minutes left. So I'm going to ask our participants who may have questions to move over to including them in the Q&A in the Whova app. And that will give you guys time to make your thoughts.
Yes. So as you guys are doing that, just recognizing that each individual has a story and it's going to be multi-layered, and how they present to session with their point of view, who they are, their background, their culture, their beliefs, their experience in and outside of systems, all of that are important factors to take into the actual process itself. And really, again, coming back to that person, but Brainspotting is so great because it being so client-led and focusing on that client's truth can really give people space to feel seen and heard and understood in a way that they may not have ever before.
Yeah. And I think there's a really important, I want to make sure we get to that question in the chat, Jana, because I think that was perfect
It's
for
the
you.
next slide, I think it is.
Yeah, but really, as we're wrapping up, the lens of the healer, right? How we look affects how we support others, how we sit with, what we include in a healing frame. What does this bring up for me? So really for us to understand the impacts of the healing relationship, the client is the expert. We offer support, but we also need to check some of our preconceived notions, our biases that may show up. We all have blind spots, and we need to be able to continue to sit with that, because regardless of what intervention we use, what modality that we use, if we ourselves are operating within frames that are has a lens that includes and what's the word that I want to use right now, but perpetuates harm and structural racism and oppression, it's not going to matter what modality we use if we're not able to ourselves in these sessions change the ways that we hold space.
Absolutely. And so to answer some of the questions, I have a specific perinatal trauma training that is open to anyone, regardless if you're trained in Brainspotting or not. I have one coming up on May 2nd. Hopefully you guys will be able to either screen grab this or be able to get the slides. But there's registration information about that. So the first day is really focused more in depth on the perinatal trauma and healing. The second day is for folks who are already trained in Brainspotting because it's more advanced techniques with the population. And I also am very excited to announce that for the very first Brainspotting training through the perinatal lens. So it is the foundational training that all brain spotters get that opens up every other training. The difference will be that I'm one of the trainers, and the other one is an international trainer out of Australia who's fantastic. And we will be using examples and demonstrations as well as the practicum being very perinatal focused. So Brainspotting can be used with almost any challenge, but this is going to be presented through the perinatal lens because there's so many people out there hurting who need practitioners around who can support and understand and give healing. So that's going to be, it's normally a 3-day, it's going to be over a 5-day because of the international time change and dateline for Australia. But that's all the information. And so basically that's where you can reach me and get information. And then for Jackie, I want to make sure, I think I did one more. Oh, here's our contact information at the bottom, but here's like resources and citations if you want to look more in depth at anything we presented. And do we have enough time to answer any of the questions? I guess we have a minute.
The other thing I would add to it as well is this is an amazing modality to use with holistic treatment as well. So if you are using holistic things, it blends perfectly. So that way we're really looking at that full person, mind, body, spirituality connection.
Completely. And what I love about Brainspotting is that it's meant to integrate into your existing practice. It's a tool in your toolbox, but it's really open and flexible. There's not a ton of specific hard and fast rules. And so that's appealing for some people like Jackie and I, and for other people who prefer much more structured approach, that might be harder for you, but it's kind of amazing because it really just takes into consideration each individual person and their needs. And so generally speaking, the phase 1 trainings are usually, I think the early registration for the 3-day is $745. I can't speak for every trainer, but for me, if anyone works with marginalized communities or if cost is a main factor, contact me directly through the website, and I'll be able to discuss that further with you, because we truly believe in diversity, inclusion, and equity. It's not just like words that we throw out into the world. And so we can talk about what might be able to assist or help people who serve underserved communities, marginalized communities, or other situations that would need further discussions, for sure.
Ladies, we are at our hard stop time because the next main stage presentation starts in about 45 seconds. So
thanks,
again,
everyone.
use source for questions in the Whova app, and we'll give our speakers a chance to get back to you on those. Thank you to your both. Thank you to the participants, and we'll see you on the main stage in 35 seconds.
Thank you so much, everyone.
You're awesome, Jackie. Thank you for doing this with me.
You as well. Thank you.
Have a good rest of the day, everyone. Bye.
Enjoy, guys.
Bye.